Back podcast family. This is Dr. Ruben Valdez in welcoming you back to Under the Avocado Tree. Today, I am incredibly excited to have Dr. Kristi Hughes, someone that I have such profound admiration and respect for. Dr. Kristi Hughes is a naturopathic physician, fully certified through the Institute for Functional Medicine. She is a global advocate for functional medicine, a medical educator. She's been part of the core faculty of the Institute for Functional Medicine over 10 years. She's been director of medical education, also at the IFM. These days, she is consulting for a lot of nutraceutical companies. She's also seeing a ton of patients and really working at the frontline level. So it is and on top of that, really rocking the homeschool mom thing, really getting it done. So Dr. Hughes, I can't even begin to tell you how much of an honor it is for me and my audience to have you today on the podcast.
Oh, I am thrilled to be here. Thank you so much. I wish we had a happier topic, but I think there's some silver linings that are coming and all the changes we're going through. So I'm excited to really get in the weeds with you and talk about, well, what do we know? And what are some new solutions that we see emerging right now today?
All right, well, let's get right into it. COVID-19, worldwide crisis, pandemic, a lot of people really afraid, really scared of everything that's going on. Let's talk about, we've seen a lot of studies coming up linking diet to increased risk and fatal outcomes from COVID-19. I know you've been gaining a lot of lessons from this data and sharing this data with your patients. So what are some of the lessons that you're taking away?
Well, I think the most important thing is to remember, not only as patients or the general public, but we really don't know it all. There's no question. It's a novel virus. We're watching like a medical detective sci-fi unfold in front of our very eyes, right? And we're living it every day, So we've got physicians who are on the front lines, who are dealing with patients who are in those extreme severe situations and scenarios, while the rest of us, I would say, are more in that tertiary care role where we're looking at preventive. What can we do to keep people well? How can we build the host immunity? How can we deal with cultivating resilience? So we say strong and healthy, so if we are exposed and when we are exposed, that we can handle things really well. So I would say, I think the world around us has really shined the light here in the United States. I mean, we're seeing it everywhere, obviously, but here in the United States, we're seeing our population that's been suffering from chronic diseases, chronic inflammation, metabolic catastrophes, right? Pre-diabetes, inner belly fat elevations, hypertension, autoimmune diseases. It is really quite interesting to see that those with those risk factors are most certainly those that are being hit hard, right? There's so much, I think, yet we don't know, but we are starting to see some trends, right? And the trends that we are seeing is that we're not allowed to talk about what works, which first of all is a really strange thing. There's a lot of politics at play in the midst of everything we're going through. And there's hard science right there staring us in the face, right? There's a hard publication showing us the role that nutrients play in dealing with this infection. So what do we know? What we do know is we've got a novel virus, which can enter through that SARS-2 receptor site, either in the lining of the lungs or either in the lining of the gut, right? And so we've got sort of these two subclasses of presentations for those who initially get this infection. Now, why is this such a deadly and complicated bug to handle? Well, I think there's no doubt what makes it not like the flu is this long incubation phase, right? Where people are walking around with a 4-day, 10-day, or 14-day window before they're getting any symptoms. And we have more than 50% of the population in some of the cited studies showing us you can go through that whole entire 40-day infection and not even know you were infected, right? And so, we're kind of walking around with some of these silent time bombs. We've got healthy individuals who seem to sail through those exposures, but we don't know, right, who may be those individuals who silently are struggling with inflammation, oxidative stress, deficiencies in vitamin C, inadequate levels of zinc and selenium. We are definitely seeing where some of the snags are. It's not a full clinical picture, but we absolutely see subtypes. Right? It's hitting the gut first, that soft, watery stool that some of our patients are getting first. Well, gosh, that's really hard to treat with vitamin C because they're going to get even more watery stool, right? So, there's kind of this interplay of trying to recognize the clinical patterns and, trying to get patients in for testing in and of itself is a disaster right now, right? If you don't have a fever, you don't have a cough, and you don't have lung fibrosis and tightening in the chest, you won't even be seen in some of these care centers, which means that this is falling back on the functional medicine, integrative, naturopathic, nutritionally oriented physicians all around the world to try to keep people out of the hospital and do what we can to help them mitigate the symptoms that go hand in hand in potentially then becoming infected. It's hard to say it's a guessing game, but we have to look at the clinical picture and make some pretty wise decisions about what are the underlying causes.
Okay, excellent. And going back briefly to that topic of the SARS-2 receptor being present both in the lung and the gut, there's a lot of research pointing to the likelihood of why some people are being way worse off in their outcomes versus others, pointing a little bit towards genetics. There's preliminary studies looking at the ACE2 gene and looking at some of these genetic factors in the populations. In your experience, is there a way that we can influence these genetics to mitigate our risk?
Yeah, I think what's exciting is just last week, one of the companies that I really love working with, Toolbox Genomics, they've got a subdivision called My Origins. They just released a profile last week. It's called the Respiratory Resilience DNA Panel. And their panel, I think, is really hitting the mark on some important areas because they have identified, and what we know, the top areas of risk, right, are for our patients who have known or silent inflammation, those dealing with specific genetic predispositions for oxidative stress, our patients at genetic risks for blood pressure regulation, especially impacting that ACE2 receptor site, right? Our patients with blood glucose and insulin dynamic issues, right? So if you're looking at chronic diseases, those 4 subject matters rise to the top. And we do know a lot about that from a genetic predisposition perspective, and we can gather that data on our patients. From a nutrient perspective, we also know that glutathione, vitamin A, vitamin C, vitamin D, selenium, and zinc, they are also the big players in the game when we're looking at that genomic risk factor picture. So all of those can now be captured. We can look at multiple SNPs that get organized into those sub-traits, and it gives us the ability to say, how at risk is this patient? Where are they at risk? And what do we want to do with their diet, their lifestyle, their sleep, their movement, and any of their other, adjunctive care to put them in the healthiest position to be able to fend for themselves very well, right? It's like precision, personalized medicine, right? Coming forward and like really one of our greatest displays.
Awesome. Spectacular. And going back to this topic of chronic illness and predisposition to chronic illness, what we call the burden of chronic disease. It seems that if we spent a lot more resources, energy in delivering this very message as to the reversal of some of these chronic disease processes, we could be saving a lot more in, energy, resources, and suffering than we are on this reactive side of the crisis. Mm-hmm. So what is your position currently regarding this?
Yeah, it's a huge wake-up call. It's a wake-up call for individuals who used to live in that world that I just need to take my pill for my ill, right? I mean, those who live in the root cause medicine world have known for hundreds of years it doesn't work that way, right? And we're walking around seeing one of the sickest and youngest populations, right, that we've ever seen dealing with chronic diseases, right? So what's the checklist of concern? Obesity, hypertension, type 2 diabetes, metabolic syndrome, cardiovascular risks. There's no doubt about it. These are all related to diet and lifestyle, right? These are all metabolic complications. And so when we look at this picture and panel, all of those can be modified, right? All of those, we have tools at our fingertips, how we live, how we do our morning to night schedule and routine, and how well we sleep and take care of ourselves at night. There are solutions inside of that story, right? So it's, I think, the exemplification of us hearing over all these years, you are basically 25% your genetics and you're 75% what you do to those genes, right? there is no doubt that we can eat the right way. We can regulate our meal time. We can use appropriate intermittent fasting. We can avoid inflammatory based foods. We can take the right nutrients, and what's so brilliant is like this condition doesn't even require extremely high doses of nutrients. It requires foundational levels, of these nutrients, zinc, vitamin A, vitamin D, right? I mean, looking at some of our basics. So, I think it forces us back to the basics to say, look, where have we been getting this wrong, right? What can we do better here in the United States? And gosh, it's really scary to see how many of our young people in this country are being impacted more so than other countries that came in front of us, right? Where they said, no, this is just going to impact those over 60 or over 80, right? It's like we have such ill children. We have kids with chronic disease. We've got young adults with chronic disease that inflammation and oxidative stress are really underlying so much of the complications that we're seeing today.
And if I can expand on that question also, Dr. Hughes, to me, it's almost a source of frustration at times because we know that a lot of these issues are in fact reversible. And the reality is that it's rarely ever talked about. When somebody walks into their physician's office so often, they don't really hear about the possibilities, right? So do you have a position on that specifically?
Oh gosh, I think many of our colleagues, our own colleagues right now are saying, what's going to come out of this that's great is there's a part of the medical system that's going to blow up, right? I mean, there's just no doubt about it. We're going to be shedding a lot of dead weight, to wait for this example, right? To wait for someone to end up on a ventilator and most likely getting treated incorrectly, is costing $35,000 to $40,000, right? And when you go back and you look at what was that triage moment where they needed vitamin C, zinc, foundational nutrients, and over the years before, could have been doing diet and lifestyle to prevent it. This is where the rubber is meeting the road, right? Kids, looking at the young teenagers, looking at the 20-year-olds who've been vaping, right? And using various different products to damage their lungs, right? Here, again, another round of susceptibility. So in functional medicine, we call all of those antecedents, right? Our predisposing factors, right? And there's such a huge uproar about labeling the deaths and mortality rates with the exposure to, SARS to COVID as well. But here we have to think in functional medicine, we've had all these antecedents, right? Altered body composition, sedentary lifestyle, inadequate sleep. I mean, we're seeing melatonin is helping with this condition, right? Mm-hmm. We look at inadequate foundations of nutrition. We look at all of these factors that lead us to the problems. Abnormal elevated glucose, higher blood pressures, higher stored body fat. These are all called antecedents, right? They build up this susceptibility for us to be at risk. So what happened? You got exposed to the virus, right? And so that's a trigger, right? And in functional medicine, you have antecedents, triggers, and mediators. And so the trigger happens to be the virus, right? And so that's why some of us get the triggered exposure and can handle it well, and others absolutely cannot, right? So what are we looking at in medicine? Well, conventional medicine has done a brilliant job in being able to deal with emergencies, in many emergency situations and scenarios. And what functional medicine, integrative medicine, and root cause medicine has been doing for 20 years is saying, really, no, treat the antecedents. That's where the pay dirt is in really preventing risk factors and bringing the dollar down and keeping our patients out of the hospital anyways, not even considering just the viral onset. So I think functional medicine has the answers, right? Because it's what are the predisposing factors? What do we know about physiology? What do we need to do to get the basics right? Because frankly, most people don't even know the basics. Most people don't even know how to read a label, right? Most people don't even understand the importance of how often they need to get up and move their bodies, or how often to time their meals during the day, or the power of sleep, right? And so as hard as it can be, there's so much rich science in getting back to the basics, right? And understanding those aspects. And I think above and beyond, we've already known that community and relationships and healthy social interactions was core. It's as though this whole social experiment is, again, reminding all of us healthy relationships and community are an absolutely imperative part of health and wellness.
Beautiful. I love that. One of the key terms, Dr. Hughes, that's being now thrown around in the world of functional medicine around this particular crisis is the term of resilience.
Mhm.
How is resilience defined? What are some of the key components that make up the concept of resilience?
Mhm. Well, I got the opportunity to interview an expert in this area last week who has really been one of my mentors as well. She's an advanced practice nurse practitioner, one of our co-founders at the Functional Medicine Institute and our coaching academy. It's Monique Class. And she has been in the trenches for decades. She was actually one of the nurses working with Dr. Oz 20 years ago, you know, at the very beginning front end of the Dr. Oz show. And so this is her subspecialty. And I loved the conversation we just had a few days ago. And it's so simple. Going into this pandemic and going into any exposure to this infection, the ability of your body's stress coping mechanisms, your hypothalamic, pituitary, adrenal, thyroid axis, right? Our hormonal response system is absolutely critical. And the state of your adrenal response and the state of your ability to manage stress going into this really dictated not only how you handle it, but what happened in that interplay between your stress response and your immune system. So if like your savings account was already depleted and drained before you came into this and now you lost your job, you are now in dire straits, right?
Mm.
If your adrenal savings account was depleted coming into this and all the stress volume came on board, you didn't have resilience, right? You didn't have that backup reserve and that capacity to, from a hormone and a physiologic perspective, draw on those elements. Right. So in resilience, building and cultivating resilience, you know, we want to maintain it, we want to sustain it, and we want to continue to cultivate and grow it. And really, it's our ability to weather the storm. Resilience is our ability to handle the stressors, the droughts, you know, the floods, like emotionally on, you know, on all these various different levels, financially. It's our ability to handle the challenging situations and scenarios and looking at what kind of a downstream rippling effect is that actually going to end up having on other organ systems and those other key mechanisms reserved for coping, right? So your stress load goes up, your sleep goes down, your inflammation goes up, your cravings go up, you eat the wrong foods, you stop moving, you get depressed, you eat the wrong foods, you don't sleep as well, your inflammation goes up, you store more belly fat, you get more inflamed, you become more insulin resistant. I mean, it is just, it's a feed forward cycle, right? All over the place. And we just have to teach our patients to stop that cycle, right? And the ways we can stop that cycle is mindfulness, awareness, rest, sleep, points of meditation, movement, eating the right foods in the right way at the right time. You know, I mean, there's some really powerful things that we can do. I mean, we can use nutraceuticals, we can use botanical adaptogens, we can use foods as medicine. There are absolutely things we can do in our lifestyle. But I think the number one crusade that healthcare providers need to be on right now is teaching their patients they have the ability to control a lot of this. Giving them that locus of control, putting it back inside of them to say, you know what, you are the boss of your system. And what you eat and what you think and how you respond is under your control. And it's like really teaching self-regulation that a lot of people never learned when they were 3. Spoken as a true mother of 4 kids.
I have to tell you how incredibly comforting and how really restabilizing it is to hear that, because it's the reality. You know, we have so much power as to what the outcomes of this entire thing can be. For some people, perhaps they might be too far gone down that path, but I think that for most, even those that already are presenting significant risk factors, there's still time to really take control.
Yeah. And there's no doubt there are high risk subtypes that, you know what, they can do all the right things and they're still going to be high risk, right? I mean, there is no doubt. My husband has cystic fibrosis, right? And he is one of the healthiest people I know. He's a nutritionist. He has been an MMA kickboxer, pro champion. I mean, this is someone who at the age of 45 has learned how to live his entire life in a bubble without getting sick, right? I mean,
Mhm.
you have individuals too who were born with some of those genetic risks and, literally walking around, he has to be aware of every single doorknob he touches and has for his entire life. Right. And there's many of us now who are like learning what does it feel like to live inside of an immune compromised world, right? Like if there's one thing I think society can be cultivating, because I think there's a big gap on what could happen, is a level of compassion and empathy, right? I mean, if there's one negative downside to watching this entire pandemic is the lack of compassion and the lack of empathy and the self-centeredness that part of the population shows. And then I think you see another part really rising to help, right? And in the words, of Mr. Rogers, right? It's like, where are the helpers when there's crisis? Where are the helpers? Always looking for where are the helpers, right? There's always going to be helpers, in those moments of crisis. And I think it gives us all an opportunity to ask hard questions, like what matters most to me? How do I think about my society and my community? In what ways do I care? What choices can I make? And there's a lot of self-actualization and self-responsibility that we need to take. And I think it's a really beautiful moment for all of us to throw that lens a little bit wider and say, what does community mean to me? And what does this planet mean to me? And really, what are some choices I can make coming out of this going forward that are more mindful, that have a better outcome?
Beautiful, beautiful. And so one of the things that as I was hearing you talk about this, and I'm going to go a little bit off topic, but I would love your opinion on this. I've already seen a couple of papers talking about people presenting autoimmunity post COVID-19. I don't know, I'm sure you saw it, Guillain-Barré and other
Yeah.
things of that nature.
Yeah.
So, there begins to be a big concern. We know that
Yep.
viruses are a big problem
Yep.
long term. So what are some of your thoughts there?
I think that's going to be the place to watch, right? Because in the functional medicine model, if instead of looking at the conventional standard of care model where we have seen here's the disease, here's the assessment, here's the treatment, functional medicine steps back to say, okay, what were the antecedents and what were the triggers? And then how does the body express that dysfunction? And I think we are going to find that in our history taking, where we've always been looking for triggers, was it the divorce? Was it the car accident? Was it the tick-borne disease? Was it the tick bite? Was it right? Was it post-surgery? I mean, there's this long list that we scan already with patients to say, what was that moment where things got worse? Like what triggered you into this next state of dysfunction, especially in autoimmunity, right? Where we're looking at toxins, foods, inflammatory agents, like we're going down this checklist of underlying causes. I think what we're going to be doing is adding to that list of triggers. We're going to be adding this particular strain of SARS to COVID, right? I mean, there's no question about it. This is going to be on our differential list of what was a triggering moment.
Hmm.
So on the back end of that, what does that look like? If we just think about the triggering of inflammation, the triggering of oxidative stress, how are we not going to see it in cognitive issues? How are we not going to see it impacting people's focus, their concentration, their energy level, right? Their sustainability. We see so many of the other chronic fatigue syndromes are augmented and accelerated when there's been the insult of some kind of a pathogen. It's like we have a new pathogen added to the list. So I think the list is going to be really long. I was just reading that same article last night that you're talking about. And, I think that is what we're going to see, right? We're just going to see literally one condition after another adding up on that list. And we're going to again have to step back and say, what were the antecedents? What were the triggers and co-triggers? And then how is that patient expressing the dysfunction?
So far, I have to tell you, Dr. Hughes, this has been one of my favorite interviews. I love your energy. I love your delivery. Fantastic. From a well-researched, well-studied point of view, moving forward, is there hope for things going back to normal anytime soon? How could that look like? How could that happen?
You know what? I think the old way of how we did things was very dysfunctional, and I don't think we want to go back to that. I think we are going to be forced, definitely. I mean, from our functional medicine leaders down, right? Dr. Bland, Mark Hyman, like these forefront leaders, Dr. Patrick Hanaway. I mean, these are the thought leaders who, created the functional medicine model. No, the message is the same. It is a 12 to 18 to 24 month run in front of us. It's never going to go back to what we were before. We are going to have to make some kind of modification. You know what? It might involve vaccination. We're going to have to rethink that. We're all going to have to step back and rethink, what does that mean? Yeah, we are going into an era where, we had a completely different outbreak of infections that wiped out parts of the population. We're going to have to think about it different. We are going to have to think about, how do we continue to live with adequate physical distancing out of respect for people, right? If we didn't have a 4 to 10 day silent incubation phase for people, and it wasn't a 40-day infection where people are walking around for 40 days shedding, we wouldn't have to be thinking that way, right? But we do. And it's because who wants that responsibility of being in that next case study published by the CDC that says, you are the one person that went to that funeral, hugged 2 family members, went to dinner the next day, you sat across the table from 3 of your relatives, and you infected 16 people and 3 of them died. Like, who wants that responsibility? And I think there is no doubt that there are those who understand those are the risks right in front of us. And then there's those who deny that that's the possibility. And what we're going to see is we're going to see ongoing wave, right? We're going to see social and physical distancing. We're going to see it relax. We're going to see more cases. What are people going to have happen? They're going to have more personal experience. Right now, if you live in some of these urban hotspots, you've got a lot of personal experience. You have family members and friends who aren't here anymore, right? Those who live in the luxury of smaller communities with less exposure, way out there in your rural areas, they're living in a different world, literally they're living in a different world. And so it's going to reach those levels over time. It's going to be a solid 12 months of we've got to watch and see what happens, right? And in that time frame, you can do a lot of the right things. You can start preventive measures now. You can start vitamin A, vitamin C, zinc, D, get these levels up, right? Because by the time it gets to your community, why would you not want to have your ACE2 receptors capable of meeting and greeting that virus and giving you a different response, right? So it's not too late in that sense. If you're not sleeping, you know what? This is one of those windows of time where maybe you do take melatonin and knock yourself out, right? And if you're sick, you have to sleep if you've got this infection. So I don't think we're ever going to be the way we were. I think we're in an unfortunate conundrum with testing because we know we need it. The testing reagents aren't available. The test kits are faulty. We've got literally thousands and thousands of batches of tests going around the world, in the UK here, that are faulty. There's false negatives, there's false positives. Do we use PCR? Do we want to be testing IgMs? Are we looking for that long-standing IgG? What role does IgA play? I mean, there are so many lab-related questions right now, and people want answers. Like, how long did it take before we got answers to testing for HIV, for goodness sake, right? Like, that was a novel infection too. Mm-hmm. How long did it take before we knew how to test and what kind of treatment options? It took 20 to 30 years before there was a more definitive state on how to manage HIV, right? Mm-hmm. And so, like, the demand that people have for, I want the test, and then I know that I'm immune. No, nobody even knows right now if you're capable of getting reinfected or reactivated again, right? So I'm very passionate about this topic. It's driving me insane on social media because, like, the expectations that people have are ridiculous. Like, why are we staying home and why are we doing more physical distancing? It's not because we're trying to tank the economy and ruin everybody's lives. It's because we are literally trying to buy some time to get some answers. And there's one question, which is, what is going on with this infection? Trying to figure it out. How do we test for it? Totally trying to figure it out. How do we treat it? Totally trying to figure out. That's one whole world that the medical research world is deep dived into. But then there's this whole other world running. Well, why? Why is it happening? This interplay with politics and world takeover, it's distorting the fact that we have a serious medical emergency going on and we need to still get those answers, regardless of who started it, if anyone started it, how it started, and why it started, and what the ultimate long-term global takeovers are going to be. We still have to deal with this information. So I think there has to be some common sense that does step in to say, we got problems to solve. And right now, we kind of do have to stay away from each other, even though we don't like it. Is it always going to be that way? God, no, I hope not. I don't see it being that way. Is vaccine the only answer? I really don't think so. In some populations, it might be, right? And I think to fall too hard on any side of the line at this moment is naive, because we don't know what we don't know. And I think the more we stay open and we deal with healthy living, healthy lifestyle, right mindset, and stay open to reading, reviewing, and really allowing for what we need to know to emerge, we're going to know in 1 year, in 2 years, looking back, what we could have done better and where our successes were. And I think nobody has that magic predictive globe today.
Well, thank you so much, Dr. Hughes, for all of your time, your dedication, your passion around this topic. In closing remarks, is there anything that's front of mind that you would like all the listeners, the population, anything in addition that you would like to add to our conversation today?
I think self-care really, we've got to find ways, no matter how hard hit we are, whether it's physically, whether it's the stressors, whether it's thinking about family members, whether it's our jobs, whether it's finances, everybody is dealing with some element that's a little out of their control. For some people, they're ending up in despair and it's devastating. For others, they're in a more privileged experience, and many of them are caring and helping and sharing, right? I think we've got to be gentle. I think we've got to be kind. I think kindness matters right now. I think sharing and caring and extending what you can to those in need is absolutely critical. It's what builds and makes a great community experience and a wonderful place to live. I think we need to be very responsible and patient. I think we need to give the world a chance to figure some things out. And in the meantime, be responsible. Take care of yourself. Think about your healthcare providers. Think about those who you may need in 2 months down the road if you walked next to the wrong person and you breathed the wrong air, right? We don't know what we don't know. So breathe, chill out, be nice, and love the people you love. And really, honestly, every day get up and live with mindfulness that what if this is your last day? And do the things today that matter most. Connect with the people that you love and care about, and go to sleep every night without regret.
Beautiful, Dr. Hughes. Beautiful. Thank you so much. Incredibly inspirational. I'm walking away inspired, strengthened, and moved. Something that I really didn't even expect that would be the result of connecting with you today. I love what you're doing, and I really respect how much of a champion you are for people and for functional medicine. So thank you so much for being on the podcast today, and I really hope that our conversation today touches the lives of thousands of people.
Thank you. It's my honor to be here. I really appreciate the opportunity. Thank you for connecting with my passion points.
Thank you, Dr. Hughes. Have a great day.
Thank you. Bye-bye.